I'm Craig Smaler, RN, Senior Housing Nurse for Newbridge Services, and this is the DMHS Medication Education Therapeutic Medications Training in-service. This Medication Education in-service is a representative survey of a variety of medications that you may typically encounter as a staff person who monitors client self-administration of medications. Anti-lipids to lower cholesterol levels. There are several classes of anti-lipid drugs. Some may lower the bad cholesterol or low-density lipoprotein, LDL, more so than others, while other medications may increase the high-density lipoprotein, HDL, the good cholesterol. The doctor's choice of which anti-lipid medication to use will depend on the client's cholesterol profile, cardiovascular risk, and the liver and kidney functions. Statins have been found to lower the bad cholesterol, or low-density lipoprotein, LDL, by 18 to 55%. It's the cholesterol that has the strongest links to cardiovascular diseases. Some typical anti-lipid medications are Lipitor, Pravachol, Crestor, Zocor, Zetia, and Tricor. Antihypertensive to lower high blood pressure. Antihypertensive drugs are a class of drugs that are used to treat hypertension or high blood pressure. There are several classes of antihypertensive medications: diuretics, beta blockers, and ACE inhibitors, which by varying means act to lower the blood pressure. A reduction of high blood pressure by 5 to 6 millimeters mercury can decrease the risk of a stroke by 40%, and the risk of a coronary heart disease is reduced by 15 to 20%. And that reduces the probability of heart failure and of cardiovascular disease. Some typical antihypertensive medications are diuretics such as Diuril and Lasix, beta blockers such as Tenormin, Lopressor, and Coreg, ACE inhibitors such as Capoten and Vazotec. Anti-ulcer to reduce gastroesophageal reflux disease, or GERD. Gastroesophageal reflux disease, GERD, or acid reflux disease, is defined as a chronic symptom caused by the return of stomach acid into the esophagus or your throat that causes a painful and burning sensation in the esophagus, which is located just below the breastbone. There are several classes of anti-ulcer medications: proton pump inhibitors, H2 receptor blockers, and antacids, which by varying means act to control the GERD symptoms. The most common symptoms of GERD are heartburn, regurgitation, and trouble swallowing the acidic stomach contents that go up the throat and back down again. Some typical anti-ulcer GERD medications are proton pump inhibitors such as Prevacid, Nexium, and Protonix, H2 receptor blockers such as Tagamet, Zantac, and Pepcid, and antacids such as Gaviscon, Maalox, and Rolaids. Sedatives to reduce insomnia. Insomnia is a symptom of a sleeping disorder characterized by a chronic difficulty in falling asleep or staying asleep. Insomnia is a symptom of a sleep disorder, not a standalone diagnosis or disease. By definition, insomnia is the difficulty in initiating or maintaining sleep, or both, and may be due to an inadequate quality or quantity of sleep. It is typically followed by functional impairment while awake. Some typical sedatives insomnia medications are Ambien, Lunesta, Dalmane, Sonata, and Restoril. Anti-anxiety to reduce anxiety and panic. Anti-anxiety drugs are prescribed for the treatment of the symptoms of anxiety, panic attacks, or panic disorders. Some anti-anxiety drugs have been shown to be useful in the treatment of anxiety disorders and are also known as minor tranquilizers that are prescribed for the short-term relief of severe and disabling anxiety. Some typical anti-anxiety medications are Ativan, Xanax, Valium, Vistarol, Klonopin, and Buspar. Anti-mania to reduce intense excitement. Antimania is a bipolar disorder, also known as manic depression. It describes a category of mood disorders defined by the presence of abnormally elevated moods. Mania, intense excitement, or seizures, which can be called epileptic or convulsive. Individuals who experience manic episodes also commonly experience depressive episodes or mixed episodes in which both mania and depression are present at the same time. Extreme manic episodes can sometimes lead to psychotic symptoms such as delusions and hallucinations. The use of this medication requires blood work for lithium, as in lithium level monitoring. Some typical anti-mania medications are lithium, Neurontin, Lamictal, Keppra, Trilipil, Topamax, Depakote, and Depakine. Antidepressants to reduce depression. An antidepressant is a psychiatric medication used to alleviate mood disorders, such as major depression. Most typical antidepressants have a delayed onset of action in about 2 to 6 weeks and are usually administered for anywhere from months to years. Antidepressants are often used to treat other conditions such as anxiety disorders, obsessive-compulsive disorders, and eating disorders. Some typical antidepressant medications are Prozac, Lexapro, Sinequan, Paxil, Remeron, Anafranil, Tofranil, Zoloft, and Celexa. Anticonvulsants to reduce seizures and mania. The goal of anticonvulsants is to suppress the rapid and excessive firing of neurons that start a seizure. Because of this, anticonvulsants have also proven effective in treating many kinds of epileptic seizures, bipolar disorders, mania, and dysfunctional anxiety. Anticonvulsants prevent the spread of seizures within the brain and offer protection by dampening the electrical conductance among brain cells. Some typical anticonvulsant medications are Dilantin, Tegretol, Klonopin, Zonegram, Depakote, and Depakine. Anti-Parkinsonian to reduce tremors and abnormal movements. Parkinson's disease belongs to a group of conditions called movement disorders. It is characterized by muscle rigidity, resting tremors, slowing of movement, or a complete loss of movement. Repetitive, involuntary, purposeless movements characterize tardive dyskinesia. Features of this disorder include grimacing, tongue protrusion, lip smacking, puckering and pursing of the lips, rapid eye blinking, and rapid movements of the extremities. Some typical anti-Parkinsonian medications are Requip, Cogentin, Miraplex, Symetril, and Sinemet. Antipsychotics to reduce psychotic behaviors. Typical antipsychotics. Antipsychotics are a group of psychoactive drugs commonly used to treat psychosis, which is typified by schizophrenia. The first generation of antipsychotics were known as typical antipsychotics, which were discovered in the 1950s. These drugs tend to block receptors in the brain's dopamine pathways, as well as a wide range of other receptor targets. The extrapyramidal syndrome, EPS, side effects from the typical antipsychotic medications are muscle contractions, slow movements, restlessness, anxiety, face, tongue, neck movements, and rolling of the eyes. The central nervous system, CNS depressant side effects from the typical antipsychotic medications are drowsiness, dizziness, sleepiness, and dry eyes, nose, mouth, and throat. Some typical antipsychotic medications are Thorazine, Prolixin, Trilofan, Melrel, Stelazine, and Haldol. Atypical antipsychotics. In 1990, a second generation of antipsychotic drugs was evolved and named atypical antipsychotic drugs. due to the lessened risk of EPS and CNS side effects. However, there are other side effects from atypical antipsychotic drugs, such as the risk of weight gain, diabetes mellitus, hyperglycemia, polydipsia, and polyuria. To monitor these risks, the client's weight, body mass index or BMI, and blood pressure are monitored, as well as the client's glucose and lipid blood values. Clozaril, or clozapine, was the first second-generation antipsychotic developed that was found to be more effective against treatment-resistant schizophrenia than the older typical antipsychotics were. A specific side effect of clozapine is severe neutropenia, which is confirmed by an absolute neutrophil count, or ANC, blood work for clients in the general population of less than 1,000 cells per microliter. This requires regular blood work monitoring of a client who is taking clozapine. The requirements for the doctor to prescribe, the pharmacy to dispense, and the client to receive clozapine are controlled by the 2015 Clozapine Risk Evaluation and Mitigation Strategy, or the REMS program, that ensures that the benefits of clozapine outweigh the risks of severe neutropenia. Therefore, the absolute neutrophil count, the ANC blood work of the client, must be submitted to the clozapine REMS program within 7 days of the client's blood draw. Other atypical antipsychotic drugs that were developed after Clozaril in 1990 are Zyprexa in 1996, Seroquel in 1997, Geodon in 2001, Abilify in 2002, Risperdal in 2003, Invega in 2007, Sapphirus in 2009, and Latuda in 2010. Staff observation to monitor for atypical side effects. Observe the clients and individually discuss with them these atypical side effect topics. Does the client consistently use excessive, say 3 to 4 or more granulated packs of sugar in their beverage? Suggest that instead of this excessive sugar use, they try to use a sugar substitute in their beverage. Are they drinking 3 to 4 or more large glasses of fluids frequently throughout the day? Are they making frequent trips to the bathroom to urinate every 1 to 2 hours all day and all night? Are they frequently eating something every 1 to 2 hours throughout the day? And do they always feel hungry and unsatisfied throughout the day? If any of your clients indicate that they're having some or all of these side effects, document and report your observations in the shift report and in the client's progress note. Make sure that you inform the nurse, the medical doctor, and the psychiatric doctor of these side effects. The test for therapeutic medications. Question 1. Some anti-lipid drugs may lower the low-density lipoproteins, LDL, while other anti-lipids may increase the high-density lipoproteins, HDL. True or false? Question 2. Antihypertensive drugs are a class of drugs that are used to treat a client's hypertension or high blood pressure. True or false? Question 3. The client's geriatric esophageal reflux disease can be abbreviated as GERD in the client's chart. True or false? Question 4. Insomnia is a symptom of a sleeping disorder characterized by a client having a chronic difficulty in falling asleep or staying asleep. True or false? Question 5. Anti-Parkinsonian drugs are the preferred prescription drugs for the treatment of the symptoms of anxiety, panic attacks, or panic disorders. True or false? Question 6. Antimania describes a category of mood disorders defined by the presence of abnormally elevated moods, mania, or intense excitement. True or false? Question 7. Antidepressants are often used to treat other conditions such as anxiety disorders, obsessive-compulsive disorders, or eating disorders. True or false? Question 8. The goal of an anticonvulsant is to accelerate the rapid and excessive firing of neurons that can stop a client's seizure. True or false? Question 9. Antipsychotics are a group of psychoactive drugs commonly used to treat psychosis, which is typified by schizophrenia. True or false? Question 10. Clozaril is a second-generation antipsychotic that was found to be more effective against schizophrenia than the older typical antipsychotics. True or false? This concludes the DMHS Medication Education, Therapeutic Medications Training in Service. Thank you.